Hello, I am at the 2017 ASCO meeting in Chicago, Illinois, and we are presenting the concept of a trial in progress, which is a study that is investigating the role of Gilteritinib in patients with acute myeloid leukemia with a FLT3 mutation. The reason why this drug is important is because it's a very potent FLT3 inhibitor. And importantly, it is one that has activity against not only the FLT3 ITD mutation, where we have other drugs that can have activity, but this is also very active against other mutations, the tyrosine kinase domain mutation, the DA35, and also the so-called gatekeeper mutation. And that is important because some patients who are exposed to other FLT3 inhibitors may develop resistance through these mutations. So the in vitro data suggests that Gilteritinib can overcome these mutations. There is also rationale in preclinical data showing that the combination of Gilteritinib with hypomethylating agents produces some synergy and increases the killing of these cells. And that's also important because, as we know, single agent FLT3 inhibitors are very effective, but they give us mostly transient responses and partial responses. So with that in mind, we wanted to explore this combination. We do know that clinically, Gilteritinib has significant activity. We've done a phase 1, phase 2 study, and particularly patients that are exposed to a dose of 80 milligrams or higher. So the lower doses in the phase 1, of course, had lower efficacy. But at 80 milligrams or higher, there is significant activity. Patients with FLT3 mutations, grossly about 50% of patients had a response. Most of these are CRPs or CRIs. We do have some CRs and some partial responses, but it is definitely an active drug. As I mentioned, the responses tend to be transient, and therefore the interest in exploring also combinations. That brings me to the study, which is a randomized trial, a multi-center, multinational study, where we're going to be focusing on older patients that have comorbidities. So these are patients that are older than 65, and that they have other comorbidities like a slightly higher performance status, for example, performance status of 3, or a higher creatinine level, etc. So these are sick patients that are very hard to treat. And the design of the study is a 3-arm randomized study. The patients can get either azacitidine, single agent, which is usually what we do today for these patients, azacitidine plus Gilteritinib, or Gilteritinib alone. So we are trying to see, number one, if Gilteritinib improves the outcome of these patients, and whether it's better to give it alone or in combination with azacitidine. We have explored these combinations in phase 1 studies, for example, with more intensive chemotherapy. And we know that the safety is very good, that the drug can be safely combined with chemotherapy. So I think that it is very likely that these patients will tolerate it well. Of course, we'll see what the data shows. And then the patients will be randomized 1:1:1, and we will see the efficacy in terms of response, and very importantly, in terms of survival of these patients. The study is opening in many centers all over the world, and we definitely welcome patients to be referred to these centers to be enrolled. Obviously, the sooner we get these answered, the better, because this is a pivotal trial that could help us get the drug into the scenario where we can just prescribe it to any patient who needs it.